What are the ethical dilemmas of drug accessibility? Imagine needing a life-saving medication but facing a wall of high costs and complicated insurance rules. It's a tough spot many people find themselves in, especially those with disabilities. The core issue here is fairness. Should everyone have equal access to the medicines they need, regardless of their financial situation? That's where ethical questions come into play. High drug prices often mean some patients cannot afford their prescriptions, which can worsen their health or even be life-threatening. This raises concerns about distributive justice, or how healthcare resources are shared fairly across society. People with limited income or inadequate insurance are hit hardest, creating bigger gaps in health outcomes. Now, think about how pharmaceutical companies operate. They often hold patents that give them exclusive rights to sell new drugs for many years. This keeps prices high because generic versions, which are much cheaper, are delayed. These market practices are driven by profit motives but can conflict with the need for affordable medication. It's a tricky balance between encouraging innovation and making sure medicines are accessible to those who need them most. Insurance coverage adds another layer of complexity. Many plans have formularies or lists of covered drugs, which can be restrictive. Sometimes the most effective medication isn't on the list, or it's only available if certain conditions are met. This can force patients to settle for less suitable options or pay out of pocket, which isn't fair. For vulnerable groups like people with disabilities, these restrictions can mean the difference between getting proper treatment and facing unnecessary health risks. Privacy is also a concern. Prescription drug monitoring programs are meant to prevent misuse, but they can unintentionally expose sensitive health information. Patients with disabilities or chronic illnesses might face stigma if their medication histories are shared or scrutinized. This can discourage them from seeking care or filling prescriptions, which is a serious ethical issue. When resources are limited, healthcare providers sometimes have to make tough choices about who gets certain medications. These rationing decisions are based on factors like severity of illness or potential benefit. But how these decisions are made needs to be transparent and fair. Otherwise, they risk increasing health disparities and unfairly disadvantaging some groups. Finally, the administrative burden of navigating drug coverage can be overwhelming for doctors and patients alike. Complex rules, paperwork, and approvals can delay or block access to needed medications. This can lead to frustration, burnout among healthcare providers, and ultimately less effective treatment for patients. Addressing these ethical dilemmas involves creating policies that prioritize patient needs over profits, reducing drug prices through regulation and competition, and ensuring that insurance plans cover necessary medications without unfair restrictions. Protecting patient privacy and simplifying the process for clinicians to help patients access medications are also key steps. It's about finding a balance that encourages innovation while making sure everyone can get the medicines they need to stay healthy. For people with disabilities, this balance is especially important because they often face more barriers to accessing affordable, effective health care.